And Dr. Kyle Plante, family physician with our weekly SOS house call. Dr. Plante, great to have you on. How are you today?
I'm good. How are you guys?
We're doing great. We're doing great. We're going to get into some concussion talk here in a moment, and ask you some questions and some myth versus reality type questions. But we do want to start with Tua Tagovailoa, who has told the media that he will not wear the Guardian cap when he returns to action, citing a personal choice. Can you speak to, I guess, first of all, what the Guardian cap is, how much that equipment helps, and whether or not you think somebody in Tua's shoes should be using something like this?
Sure. Yeah, it's a very common question in my concussion clinic. People ask me this constantly about things like the Guardian cap or the Q collar or various other things. And they're all relatively new, ways of trying to reduce, either the impact of concussions or the risk, certainly. And so the Guardian cap, it's pretty popular, probably one of the more popular ones currently in use, and a lot of that's made kind of popular by the NFL. They publicly endorsed them, I think, in about like 2022, maybe 2 seasons ago, for preseason training. It's a soft shell cover that goes over top of the football helmet, and the idea there is to attenuate head impact magnitude, lessen the impact experienced by the person wearing the Guardian cap. And so, I mean, the short of it is that there's not a ton of great data out there research-wise showing whether or not it is or is not effective in preventing concussion from these impacts. So the NFL has their own kind of data collection system, and so I know they have said that they've seen somewhere around a 50% reduction in these concussions compared to some of the previous years that they had seen their athletes wearing them in preseason. So I think it was 2018, 19, and 21 that they had compared to. But this data is not publicly available, out to be published. And so there are other studies from different academic groups around the country. A lot of it's laboratory-based kind of simulated impact testing. And so it's helpful but not the same, obviously. And they haven't had any good definitive data in either direction either, saying, whether or not these are actually useful in preventing concussion. But it's a very hot topic that hopefully is being, we'll see better kind of data sets come out here soon that we can look at. But I think one of the other things Lester talked about conditions as related to the use of these caps would be something called repetitive head impacts, or the RHI, right? And so maybe, we're looking at the reduction in incidence of concussion, but also just having these repetitive impacts can also have long-term changes in parts of your brain. And so, one of the other questions for these Guardian caps and some of the other devices is that, does it reduce the amount of magnitude of these RHI kind of events, and whether or not that can actually help in a long-term perspective, because these RHI impacts are not they're not of high enough magnitude to cause a concussion necessarily, but if you think about it, the alignment with each play, every open field tackle, there's repetitive blows, essentially every down. And so, so I think there's a lot more than just the incidence of concussion that I think goes into some of these things too, that we shouldn't overlook. That there may be, in the NFL, there's just so much velocity and so much speed that these people are tackling at, to where maybe they don't see that effect there, but Pee Wee football, with these kids, maybe it is effective for that group. So,
Yeah.
Like I said, the short of it is, it's still, the jury's still out.
Yeah. I mean, and you look at Tua's last concussion, the one against the Bills where he ran into DeMar Hamlin. It didn't even look like it was, that big of a hit. It just,
Right.
he's got the history of concussions and led to another one. And obviously you hope that he's okay moving forward. All right. As we promised, let's get to a little fact or fiction, true or false, when it comes to concussion. So the first item is you need to be knocked out or lose consciousness to have a concussion. True or false?
False. So somewhere around 10%. I think 10% of concussions actually include a loss of consciousness. And it doesn't, importantly too, along with this is that having a loss of consciousness doesn't necessarily mean that the concussion was more severe than a person might have if they did not lose consciousness. Someone who maybe did not have a loss of consciousness could have a longer recovery or a more severe, course of this. And so it's certainly something we take into account. And every time you have a loss of consciousness, it is automatically defined as a concussion, but it doesn't necessarily mean that it's going to be worse.
All right, the second one, you need to have a direct blow to your head to have a concussion, like helmet-to-helmet contact in football.
Also false. That's certainly common, that you see that it's the head-to-head contact, but really it's any type of mechanism that jostles your body and shakes your head. So you think of things like a whiplash in the car crash, people who fall down the stairs, or a big tackle, a big hit, to where maybe you didn't get head-to-head or you didn't hit your head on the turf after this hit, but you whiplashed your neck back. That can be enough to cause that type of motion kind of travel up towards and shake your brain.
I think this third one is interesting. You should keep someone with a concussion awake. Don't let them sleep for a long period of time. I think that's something that would be.
I heard that as a kid all the time.
Right, that would be like a knee-jerk reaction. I think for most would say like, no, don't let them go to sleep. But that's false, right?
That is false. That was something that, like you said, years and years ago, that was kind of a rule because people were thinking, if you have really severe brain injury, you have a risk of falling into, a coma or having seizures or having, these kind of things. And you can see it with some really, really severe brain injuries that you see in motor vehicle accidents and things like that. But your typical concussion, that's more characterized as mild brain injury. There's no benefit in keeping it up. You're really just going to make their symptoms worse by waking the kid up every 2 hours, and it's really not going to provide any benefit. Actually, sleep is going to be helpful for them, especially in the early stages.
All right, what about somebody who goes to the emergency room or they go to urgent care and they have a scan of their head? Is it possible to see a concussion on some type of scan if you went to, like, the emergency room?
Right, yeah. A lot of patients I see come in and have already been seen in the emergency department, have already had, a CT scan of their brain, and there's no imaging modality that would effectively show a concussion itself. Certain imaging modalities can show brain injuries by way of brain bleeding and that kind of thing, but typically that's with the really severe head traumas that you see, or certain select population on blood thinners or things like that, things that typically athletes are not on, certainly not contact sport athletes. They're not on blood thinners for obvious reasons. And so none of those imaging modalities are gonna reveal a concussion. It's still a clinical diagnosis, something that we make based on the history, the physical exam on the patient, and what they're relaying as their symptoms. And so there actually are there's a lot of work going on right now in the research field around this with trying to find markers to do tests, even sideline tests. So they have saliva tests that are being worked on to try to detect certain biomarkers that are released during an acute concussion. The idea is to hopefully have that available. If we could have that available on the sideline, it takes the guessing work out, right? And so it's certainly something that's not ready yet, but it's something that is a very big hot topic in the concussion world.
Now, Dr. Plante, I think we all know most of the the telltale signs of a concussion: headache, pupils dilated, light sensitivity, those kinds of things. Is it possible to have a concussion without any symptoms at all? Like you get hit and you feel fine, you don't have a headache. Can you still have a concussion?
Yeah, so it's typically the concussion is diagnosed based off the symptoms, and so eventually you'll have to have symptoms in order for that to be diagnosed as a concussion, based on what the hit looks like. If you can see it, if you're there to witness it, you can certainly suspect a concussion based on the mechanism, but a lot of, in some cases, the symptoms of the concussion won't show up for hours or even days, a few days after the injury. You have a Friday Night Lights, some kid gets hit and then, didn't really think much of it, maybe, had a little tired after a game, kind of normal, and ends up going to sleep, and then has Saturday, Sunday off, comes in Monday for practice, and the moment they start kind of getting going and getting their heart rate up, they start to have a ton of symptoms. And that's a very common scenario that you see. And so almost, but that's very normal. You can have those early feelings like being dazed, having some confusion, some headache, dizziness, memory loss. But some of the light sensitivity, noise sensitivity, irritability, mood changes, difficulty sleeping, that kind of stuff can be some of the ones that show up a little bit later.
All right, last one. True or false? You must be completely symptom-free to begin a return-to-play program for your sport or activity. True or false?
False. So that was always kind of a better be safe than sorry kind of way of going about it, especially with the pediatric population. You think about high school sports. They want them to be completely symptom-free before you start getting back into it. But research has come out showing that an early aerobic type activity, so getting your heart rate up a little bit, certainly within the first few days, if able, certainly, within the time period where your symptoms are somewhat manageable, we want you doing that. That increases the blood flow to your brain. It helps kind of wash out this what we call metabolic cascade of events that are happen in response to the injury, and it's been shown to reduce the duration of your symptoms from the concussion and reduce the magnitude of those symptoms that you're experiencing, especially early on. And so trying to get back out there and certainly not in any type of activity that increases your risk of having another head injury, but going for a walk around the track, doing those kind of things more than just sitting in a dark room and, hiding under the covers until you feel better. That's not what we do anymore.
Interesting. All right, great stuff. We appreciate you coming out. Very informative. Thanks so much for the insight, Dr. Plante. We appreciate it. Have a good rest of your week, and we look forward to the weekly SOS House Call next Wednesday.
All right. Sounds good, guys. Thanks again.
All right. Dr. Kyle Plante, family physician from SOS. And with that, we'll take a timeout. We'll wrap up hour number one next. And then coming up at the top of the hour, Jerry DePaula will be on with us, sports writer from the Pittsburgh Tribune-Review, to preview Syracuse and the Pitt Panthers. We're back after this on ESPN Radio.